Health Minister Dr. Keith Mondesir recently returned from Taiwan. He was in attendance at the 2008 Global Forum for Health Leaders. Dr. Mondesir says he came away with a new appreciation for Taiwanese medicine and the international standards of healthcare. The trip also provided the health minister with new insight into the health information system to be implemented in St. Lucia shortly.
Under this system, I saw in Taiwan a group of people just reading newspapers on the internet from every country. And the reason for that is that they're saying that if you depend on a government to tell you there's an outbreak on their island, you'll have to wait a long time. But you will always find it in a little newspaper on that island before the government will make an announcement. So they go that way. And then you have mobilization whereby they could localize where on that country that the outbreak is.
Dr. Mondesir also came away with a new respect for primary healthcare systems. He says these are the most effective for delivering healthcare, especially in small island states with limited resources.
When we think of in primary healthcare, you must think of the level of care. For that level of care, you have to maintain that level of care through surveillance and through accreditation. You must accredit the institutions that train your health professionals. You must look at your pharmaceuticals and the level of in terms of quality. And most of all, you must pay attention to the society that you deliver it. It must be acceptable to that society.
Program implementation is of monumental concern to former CMO Dr. Stephen King. Dr. King says the government has had enough time, 2 years, to move away from examining systems. He says the time for implementation has long passed.
I know that we have health plans. I was part and parcel of the development of health plans, including the universal health care. I want to hear the Prime Minister give a concrete response on what is happening to the health plans, what's going to happen to universal health care, because I know, and we all know, and Kami, you can take your cameras anywhere and you can parade people in front of that camera that are hurting because they don't have access to the health care that they require. It happens, you see people begging for money all the time for surgery, medications, and so on.
The health minister also facilitated the twinning of the St. Jude's Hospital during his trip. He says the VA4-based hospital will twin with the Taiwanese hospital with a capacity of 1,800 beds. Carmi Joseph, HTS News, Channel 4.